You hear the stories of many people who contract COVID-19, quarantining for 14 days, and healing from the virus. But there's a community of people who've battled COVID-19 for months now. Ariel Brumfield spoke with one Bend woman about her experience.
38-year-old Brianna Neves is considered a long hauler and has been battling COVID-19 for almost 18 weeks now. Neves, who works as a behavioral health adult specialist, had no pre-existing medical conditions, ate a plant-based diet, and worked out regularly. She says she did not expect to be suffering so severely from the coronavirus. She experienced shortness of breath, which she thought was just allergies, but later contracted viral conjunctivitis in both her eyes, prompting her to get tested. Neves, who never actually had a fever, one of the more popular symptoms of the virus, says it made her experience with doctors and getting tested even more challenging.
And the challenge of this is that you're trying to believe what's going on, and you're also trying to teach your medical team what's going on, because this is brand new for them. And for some of the physicians I've worked with, I was one of the first patients they'd ever worked with COVID. So that shock, surprisingly, actually in week 17 or 18 now, it's something I'm still working through.
Neves, who has been working from home since the second week of March, was tested the first week of April. She now takes 3 asthma medications, is reliant on oxygen 24 hours a day, and struggles to do her normal everyday activities.
The game changers for me have been physicians that are willing to stand next to me and say, I don't know. I want to keep learning from you what this looks like. So there's a definitive difference between the physicians that really want to put me in boxes they're already familiar with, that COVID just absolutely does not fit within, which impairs the level of care that I have received.
Neves says some physicians have continued to educate themselves with up-to-date information on what COVID-19 can look like, while others focus on specific parameters. She says this is one of the many reasons why many people don't believe COVID-19 can last so long or affect people who are young and healthy.
The thing that has gotten me through this are other long haulers like myself that have been willing to share their story, that when I've read those stories along the way, it's been my lifeline to not only know that this is real and kind of help deal with the shock that we talked about, but also that I'm not alone.
Brianna Neves says this experience has been isolating for her and difficult as she continues to work from home, but she's hopeful that by sharing her story, it'll help the medical staff treating COVID-19 patients and encourage others to take the virus more seriously. Ariel Brumfield, News Channel 21.